Let's study about placental abruption. You should focus on the following keywords in the scenario. There will be shock-like symptoms, that is maternal collapse, increased heart rate, decreased BP, feeling cold, and lightheadedness. You will also notice a decreased fetal movements, painful vaginal bleeding, and tense uterus. What is placental abruption? It is the premature separation of the placenta from the uterine wall. It results in the bleeding with pain. Bleeding can be from the maternal side or the fetal side. Although it is dangerous for the both, but it is more dangerous for the baby. What are the risk factors? Risk factors include hypertension being at the top. Also, it includes smoking, cocaine use, trauma to the maternal abdomen, multiple gestation. Highest risk being a previous abruption history. High BP, smoking, cocaine use become a risk factor as they all lead to blood vessel constriction throughout the body, including the vessels in the placenta too, and ultimately result in the abruption. Diagnosis is majorly made on the following clinical features: increased heart rate, decreased BP, tense abdomen and tense uterus, decreased fetal movements, painful vaginal bleeding. Investigations include ultrasound. When it comes to management, if the fetus or the mother is stable and are not compromised, just give the symptomatic treatment. But if there are signs of fetal or maternal compromise, then plan C-section. Pass the IV line, CBC, baselines and clotting profile, cross-match, mother and fetal monitoring, Foley's catheter, and arrange blood. Admit the patient in hospital for 48 hours as there is an increased recurrence of the bleeding in the first 48 hours. Give the steroids if the fetus is less than 34 weeks. Check the rhesus status of the mother and give anti-D injection if the mother is Rh negative, and plan C-section. Here are all the past paper questions, are the scenarios. You should focus on the following keywords. I've highlighted them: painful bleeding, pulse is 120, BP is decreased, and abdomen is tense. Similarly, in the next scenario, there is a heavy vaginal bleeding, abdominal pain, decreased fetal movements, and uterus is tense. In the third scenario, there is sweating, pulse is increased, BP is decreased, there is vaginal bleeding, and fetal heart is absent.